in the first place, you need to carefully select the kind of family planning method that is suitable for you. Most likely, you are not suitable, your system does not suit this very type of pill you took. Before you choose a family planning method, you need to speak with your health worker, and if he advises you based on history, based on interaction with him, he will be able to appropriately choose a family method pill that is appropriate and that will be good for you. For now, you could stop the pill and then go see your doctor. The next question is also very an interesting one. It says, does diabetic occur in children? The answer is yes. It's not just diabetics. There are other chronic illnesses that occurs in adults. They are also found, unfortunately, in children. You could have some tumors, you could have nephrotic syndrome, you could have even high blood pressure in children. So if you notice any of these, please do not stay at home. Take that child to the hospital where he will be attended to. I'm also very happy what the next question is saying, because it says, I'm watching your program now on Wazobia Max, and it is very interesting. We thank you for that. I have a son with sickle cell anemia. He looks healthier than his other siblings, but I noticed he gets tired easily, especially whenever he runs for maybe 30 minutes. Is there anything I can do to boost his energy, or is it normal for people of such syndrome? Yes. You see, if a child or anybody that has sickle cell disease, that child cannot engage in strenuous activities like every other normal child. So for the fact that he plays and runs for like 30 minutes, he's even doing so well, please prevent him from doing strenuous activities. Let him have enough fluid. If he needs to see a doctor, let him do so. But he cannot stress like every other child. But we are happy for you. Your child is very healthy. The next question says, hi doctor, my baby is 7 months. He wants only breast milk. He vomits all food. Please, what can I do? Yes, all you need to do is to try him on other foods. Try him on family feed. Try him on semi-solid feeds. Just try him in other foods. So he may like some, he wouldn't like some other ones. So if you do that, you will find the type or one that he likes, and you can feed him or her on that. And this question goes this way. Hi doc, I have 2 children. In the last few months, I felt the symptoms of early pregnancy, and I begin to experience some movement in my tummy. But as I went to the hospital to register for antenatal, the 2 different scans I did show that I am not pregnant, but have fibroid. Whereas my menstruations still come every month, though very light and takes duration of 3 days, unlike before when it used to be 5 days. Please, does fibroid kicks like baby in the belly? Does fibroid bring about protruded belly and heavy painful breast? I need your advice. Yes, fibroid can make your tummy bigger than usual. It can disturb your menstruation. You can bleed even more than usual. And it doesn't kick. It is the feeling you are having. It is the mass that is moving. That is the fibroid itself. Then you take it to be kicking of babies. And of course, for you to know you are pregnant, you need to do a test. It is when the test says you are pregnant that you can say, I'm actually pregnant. However, it is obvious that the fibroid has become symptomatic. What it means is that it's beginning to disturb you, and it's going to disturb you even more. So you could seek medical advice. So most likely they may do a surgical removal of this fibroid, and you'll be yourself again. And if you desire to have more children, and then you can consider that after this surgery. Because of time constraint, this is where we are going to stop for this very episode. If your questions were not answered, please be sure that next week yours can be answered, especially if you put your name and your location. Keep watching and keep sending in your questions, and we are here to attend to your questions. We now go back to Miriam.
Prostate cancer is the development of cancer in the prostate. The prostate is a gland in the male reproductive system. Most prostate cancers grow slowly. However, in some other cases, the cancer grows relatively quickly. The cancer cells may spread from the prostate to other areas of the body, particularly the bones and lymph nodes. It may initially cause no symptoms. However, in later stages, it can lead to difficulty in urinating, blood in urine, or pain in the pelvis or back. Factors which increase the risk of prostate cancer include older age, a family history of the disease, and race. Most people with prostate cancer do not end up dying from the disease, as about 99% of cases occur in males over the age of 50. Globally, it is the second most common type of cancer and the fifth leading cause of cancer-related deaths in men. In fact, autopsy studies show that many older men, and even some younger men, who died of other causes also had prostate cancer that never affected them during their lives. In many cases, neither they nor their doctors even knew they had prostate cancer. In 2012, it occurred in 1.1 million men and caused 307,000 deaths. And since then, the rate increases in the developing world. Many cases are managed with active surveillance or watchful waiting. Other treatment may include a combination of surgery, radiation therapy, hormone therapy, or chemotherapy. When it only occurs inside the prostate, it may be curable. In those whom the disease has spread to the bones, pain medications and bisphosphonates and targeted therapy, among others, may be useful.
Men above 40 should check. There are two ways to actually check for it. One is what we call the digital. The doctor would examine and check to see if the prostate is enlarged. Now, if it is enlarged, it doesn't necessarily mean there's cancer. Okay? Now, but to be sure if there's cancer or not, you do what we call a PSA. All right? Prostate-specific antigen test. Now, the levels will determine if the person has a cancer or not. One of the things you probably notice with men is difficulty in urinating. And some will go very often to urinate. Some will tell you, they can't hold the urine. They have to run to the toilet to urinate. Sometimes, I'm actually talking about when the prostate is large. Okay? Now, for the cancer itself, you will just be surprised you might see anything until maybe it has spread to other parts of the body and start creating its own challenges there. That's when you now know somebody just does a screening and that's when you find out.
Regular screening is therefore advised as the best way to detect it in good time.